Many of you have had questions about bilateral alternating stimulation. I wanted to go over some principles with you. The first principle is that in the EMDR community, the tendency is to call it either dual attention stimuli or bilateral stimulation. I don't refer to it as dual attention stimuli because the attentional network is not necessarily one of the primary networks that we think is associated with the effect. I also don't simply use bilateral stimulation because it's very, very important that it's actually bilateral alternating stimulation. There's an A in there. If it's synchronous, okay, or if it's continuous, it does not have the same effect, and there is research that points to that. The other differentiator we want to make is the type of bilateral alternating stimulation, and there's three kinds. You know, the auditory, which are the alternating tones, the tactile, alternating vibrations such as in TouchPoints, and then the visual, which is the saccadic or smooth pursuit eye movements. All right, so we want to differentiate B-L-A-S-A, B-L-A-S-T, or B-A-L-S-E when we're talking about the different kinds of stimulation. Now, my favorite kind is in the TouchPoints. It's blast with the tactile, and the reason why is you can actually use this in all phases of EMDR therapy, okay? And I will do another training on that later. But I want you to take away from this talk that these forms of bilateral alternating stimulation are absolutely not interchangeable. You may have been taught that, and I'm here as a neuropsychologist telling you they are not interchangeable. Please remember this. Do not give your patients a choice of, do you want to do this, this, or this, and think that they're all having the same effect. Your auditory cortex is organized a lot different than the somatosensory cortex in your brain, and the eye movements seem to be doing something completely distinct from the other forms of tactile stimulation or auditory stimulation, even though there is some overlap in effect. The caution I have with using auditory is that there are two studies that show that auditory was inferior to the other kinds of stimulation. The first in 2013, Brain and Cognition, showed enhanced memory retrieval was found with the eye movements and the tactile stimulation, but not the auditory stimulation. And a study in 2012 in Behavior and Research Therapy showed that tones were inferior to eye movements with patients with PTSD. There's a lot more research out there. I just wanted to highlight that for you. And what we do at the Serin Center, and this is part of the reason why, we will use the alternating tactile stimulation in all phases of therapy, and it's safe for patients to use outside of the office without risk of dissociation. If you're in the desensitization phase, I want you doing eye movements, okay? A lot of your patients will say, oh, I might be getting a headache, or they'll have a somatic reaction. That's actually part of the processing. In my 10 years of doing this, I've had very, very few patients who were not able to do the eye movements. Now, certainly in the case of somebody that's visually impaired or things like that, you know, you go to that, but don't just immediately move off eye movements if somebody's a little bit uncomfortable. They will probably work through that, and that's part of the processing that they need. Here's how to use bilateral alternating stimulation in the tactile form in phase 1 of EMDR. Now, we're going to call this blast for short, and you can use this when your patients first come in and do history taking. Blast has been shown in multiple studies to enhance comfortable feelings, improve memory retrieval, promote relaxation, and reduce the EEG amplitude in brainwaves associated with anxiety and stress. So you don't need to be afraid of dissociation in a patient. In fact, using multimodal and physiological brain hacks like blast technology during phase 1 can actually help your patients calm down, and it can add some desensitization to their stressful experience of coming in to see you for the first time. So when my patients sit down and before they start talking, I let them know that most people coming in to their first session are stressed out. And I offer them bilateral alternating stimulation in tactile form. So you can have the wristbands on and have them already on and have the patients wear them on their wrists. You can also take the center modules out and have them hold them in their hands. And you can tell them that they can try it and it should help reduce their stress levels. And if it doesn't and they don't like it, they can simply turn them off and they're in control. This can bring your patients a lot faster relief in the first session. That's often a very stressful thing for patients.